For 40 years, from 1932 to 1972, a secret study unfolded in Macon County, Alabama. It was funded by the United States government, and it came at the cost of African American lives. The project became known as the Tuskegee Syphilis Study, but those enrolled were never told the truth. Nearly 600 African American men, most of them poor sharecroppers, were recruited with promises of free medical care. They were told this care was a gift, a sign of progress. Instead, they were deceived. The men were told they were being treated for bad blood. In reality, 399 of them had syphilis, a deadly but treatable disease. They did not know they were sick. They did not know they were part of an experiment, and they were never asked for informed consent. This was a systematic deception, orchestrated by the very institutions sworn to protect them. As years passed, the disease ravaged their bodies. Syphilis caused blindness, organ failure, paralysis, mental deterioration, and death. But the horror did not stop with the participants. The unseen tragedy spread into their homes. Wives were infected by husbands who were unknowingly casualties of this study. Worst of all, innocent children were born with congenital syphilis, a legacy of pain passed down through a scientific betrayal. The death toll was staggering, extending beyond the 399 men to shatter entire family lines. And still, the study continued, sustained by the silence and corruption behind the scenes. By the 1940s, penicillin was widely recognized as a safe and effective cure, but the treatment was deliberately withheld. The doctors involved were not healers, they were observers, documenting the slow destruction of health for academic gain. They consciously chose to prioritize data over human life. This hidden agenda went right to the top. Even when participants were drafted into World War II and diagnosed by military physicians, another government arm, researchers intervened to block the life-saving treatment. They ensured the study, their cruel data set, would not be disrupted. This was not negligence, it was policy. A cold, cynical decision backed by the authority of the U.S. Public Health Service. For 4 decades, the truth was buried behind medical authority, academic journals, and government silence. The participants placed their solemn trust in the government, in the medical professionals, and even in the military system. That trust was exploited, shattered, and utterly weaponized against them. Many died believing they had been helped, not harmed, never knowing they were disposable research subjects. The study only ended in 1972, when a whistleblower exposed it to the press. Public outrage followed. By then, the damage was irreversible. Dozens of men were dead. Families were shattered. A community was left with scars that would last generations. In 1997, the U.S. government formally apologized. But an apology cannot restore lost lives or erase the lesson. The Tuskegee study stands as a stark warning. When secrecy replaces ethics, when corruption infiltrates high office, and when people are treated as data instead of human beings, the cost is measured in suffering and in lives. It is a harsh reminder of trust being placed in the wrong hands.